and he's saying that we are in a very dangerous period of the pandemic as a result of this variant that is mutating very quickly. And talking to us about this is public health specialist Tui Mebawadu. Good morning.
Good morning.
Thank you for joining us in TVC Breakfast. Now, looking at the statements made by the WHO Director General, I wonder how much of a challenge this poses to the pandemic. How is it going to affect, the gains already recovered so far, if I may use that word? What concerns do you have? So many questions here to be answered.
Quite a concern because now we saw the Alpha, Beta, and now we are now seeing at the Delta variants, which originated from India in 98 countries now. More than 22 of those countries are in Africa. And if we see the recent surge in Africa of the COVID-19 is due to the Delta variant. The Delta variant is more effective, leads to more dangerous symptoms and affects younger generation. Of course, the key thing that Africa used to brand it as is their own super way to fight the COVID was the younger generation.
Yes.
But now this variant is affecting the younger generation the more. And we see South Africa, Namibia,
Ghana.
It's in Ghana already, and then Tunisia. They're seeing a lot of those. In fact, in Uganda recently they were pushing for a lockdown, even in South Africa, which led to a lot of challenges. No, so it's a huge problem because when it gets to Africa, when it gets to this sub-Saharan Africa and gets to other part of Africa, how do we cope? Well, because we need to ask that question because one, you see a lot of the public is tired. There's a public fatigue ongoing. You tell people to wear face masks, they don't want to wear. They're fatigued. Africa has so much burden and so many burden without any sign of resolution inside. You are dealing with health challenges, you are dealing with economic challenges, you are dealing with banditry, you are all sorts of things. The public is fatigued. And then if this Delta variants then further spread in Africa, it will further knock down the economy, which contracted as much as 1.5% of GDP. And we lost the first and second wave, we lost as much as 3 trillion naira. So unemployment, more than 30%, inflation, double digits. So what are we going to do if we don't honestly find ways to deal with this Delta variant?
Now that's because you've mentioned so much. It's here in Ghana. Ghana is Nigeria's closest neighbor. And we know what our borders are, how porous it is. And you mentioned something, addressing it, because this is what WHO is saying, pushing it back, showing that leadership. What will that constitute for a country like us, where our borders are so porous? Those coming in through the airports, we have tried to even tighten the noose, but we still see some leakages. Now, come to think of the borders, I wonder what we have on our hands.
Well, what the government has done is to say, well, they're increasing surveillance, they're trying to prevent
how far has that
movement.
gone?
Yeah, I call it that. They're doing the movement of people from those countries. I sat down, I thought about all these things. These things will not work. Let's be fair.
Why?
Let's be frank. Okay, look at the simple non-pharmaceutical intervention that we've been talking about. Go out there in the street. Who is wearing face masks? Who is doing social distances? The parties are going on. So these things will not work. The only thing that can work as we are now is for us to find vaccines by any means possible.
But we are already doing that. We are vaccinating.
You cannot vaccinate just about 2 million out of 206,000 people. What would that do for you? Now, because right now, we've seen that the legal aspect of imposing those preventive measures is not working. The only thing that can work now is to see, okay, where do we get vaccines? Unfortunately, even recently, WHO, the $4.4 billion that WHO, is giving, the World Bank is giving to countries without means, that cannot get the vaccine. Nigeria is not included.
Yeah. Yes. So
how do we get money? How do we balance our sheets? We see that our economy is contracting seriously. We're having financial challenges. There are a lot of unrest in the country. So many things to spend money on. Where are we going to get money to do that? So it is essential.
But we also have to consider the fact that the health system in place, if we have an outbreak of this Delta variant, may not be able to handle the challenges.
That's why I'm saying that the only thing that can change the thing in Nigeria is for us to look for vaccine.
But how much has vaccine changed in addressing this whole situation?
Listen, look at the countries that have vaccinated.
Yes.
Up to 50–60%.
Right.
Even UK recently is thinking of opening up the whole space. They found out that even the vaccine prevents, because what we're targeting now is attack against the severe illness caused by COVID. It's not that person will not get COVID, but the severe illness is what actually puts such pressure on the health system. The only way you can deal with that severe illness now is either you don't pick COVID at all, or you are vaccinated against COVID. In fact, the vaccine existences were so troubled about, it's not so much happening. Because you see a lot of people really wanting to take the vaccine, okay, even in Nigeria. But where is the vaccine? The vaccine is not available. Recently, Morocco signed, a licensing agreement with Sinopharm to produce those vaccines in Morocco. We should be able to look for where to sign a licensing agreement with one of those companies that you can then have to produce vaccine in Nigeria. We just have to look for vaccine. Because all this hand washing, social distancing, giving yourself a space is not going to help. The virus kept mutating. We need to fight the virus before the virus becomes worse and gets to another thing. We can't block our borders because people are, even at the border, they take bribe, people just walk in and walk out. Where are the borders in the first instance? You can be talking about people that need to fly into the country, one of those that needs to walk into the country or ride bike into the country. So, honestly, the solution now, let us look for vaccine.
We've been talking about this search for vaccine for a long time, since COVID began. And we talked about perhaps having homegrown solutions. And we moved from there. People began to say, okay, maybe as a region, talking about West Africa now, we should sit together and say, let's come together and deal with this head on. We can't keep waiting. Let's look inwards and address issues.
You see, even this vaccine we're talking about, getting vaccine could be easier than all we're thinking about. Okay, now.
So what's the challenge?
We have the emergency use authorization were for 8 vaccines.
Yes.
Okay. Out of those 8 vaccines, it's only about 4 that's in use in Africa. The other part of the world then. Recently, US gave as much as 55 million doses of vaccines, 45 million of that to Africa, and the remaining 15 million or so, or 10 million to South America. Now, these are interesting things that can be, warehoused in the COVAX, this thing, and then used for Africa. But the simple thing is this: get a licensing agreement.
That's just the way to go.
Within a year, a factory will be standing, because you see, we know companies and people that can build within a year a standing factory that will produce those things, and then it can actually be adapted to produce other vaccines. When you get the licensing agreement, that aspect is sorted out. Then you put the factory on ground and you produce vaccines and give to your people. Let's face it. You see what's happening in UK. UK is opening. In fact, they are putting the burden of you complying with the protocol on you. It's not a legal issue again. They are trying to move it because you have to get to a point where you have to look at that. Is what I'm doing, is it really working? Is it working? Now, Nigeria tested barely 2-point-something million out of the whole population. That cannot be a reflection of what is going on.
Right.
Okay? So, if we cannot test, and then people are not obeying those non-pharmaceutical protocols, what options? And then people then can sneak through the borders. What option do you have? Look for vaccine. Look for vaccine. What option do you have?
I do hope that the necessary persons are listening to understand the dimension. So how can the private sector come in? Because earlier you mentioned how, the economy has been stretched as it is right now. And we saw, even at the beginning of the pandemic, how the private sector tried, to, coming to also help the government address some areas that they felt they needed to come in. as it stands now, looking at this, where do you think the private sector can come in?
Again, see, what we need to do is to have a kind of, you know, a synchronicity, because one, even the fund for private sector is drying up. The economic is contracting, the buying power is reducing, and they have a lot of burdens to deal with here and there in terms of running a company. The profits are, you know, nosediving. So what we need to do is to look at it at that level, that, wait a minute, because let's face it, how was India able to produce vaccines even before the COVID came up? Because somebody woke up at the Serum Institute of India. There's another company also that is producing vaccines. They are private concerns. So we look at that across that spectrum. Bank of Industry has fund to help industry. CBN has fund for health. There are agencies, government agencies that might be interested. We must be able to see a kind of cooperation between the private sector in that regard and those government agencies to fast track building of the licensing agreement, the building of the companies, and then the production of the vaccine. That is the aspect. If we see the involvement of the private sector in this regard, you see fast track. We have pharmaceutical companies that can stand up and even do a repurposing of their production line, bring those equipment in. In fact, most of those equipment are produced and shipped for fixing in this part of the world. We know them. It can be done. It has been done. It can be done. It's just the will to want to do it. Because
what is staring us on our face?
Balance sheet.
Right.
The government is claiming no money to do that. So now that is why the credibility of any country in the international space is important. If you have the right credibility, people will move in and say that, listen, don't worry, I'm going to ensure the license agreement comes up. When that one comes up, okay, we'll situate the plant somewhere here. We look for fund here and there. People put, contribute as investment into that, and they get vaccine. At the end of the day, you could be able to get the vaccine for as low as $1-2, instead of $4-7 that is being sold for elsewhere. And then if you talk to government to government, multinational to multinational, and then private sector to private sector, aligning in that mix, we can get those company running in a year. We can get the company producing in a year.
Why we wait for a year, but between now and that time, hoping that something is done. No, let's keep hope alive. What can we do as a stopgap measure, right? That is on behalf of the people now, because I remember just yesterday while I was wearing the face mask, some persons were asking me, why is he wearing the face mask? Why? And I said, tell me, I'm not aware. Is COVID-19 over? Has it gone? And they were like, no, it's no longer here. So take it off. So what can we do now in terms of stopgap measures while we wait to see the steps government will take that you have pointed out that is the way to go? Hopefully they will turn in that direction, but stopgap measure for now that we can take as a people.
What we're seeing now is the discussion, the conversation on COVID-19 is receding from public space. You understand? The symbol for fight against COVID-19 used to be, some group in presidency, with a certain tag. Now, even their own briefing has become a tired repeat. We just come, we have 50 cases, and everybody just pack their load and go away. We need to re-engineer, because, you remember at the beginning, for instance, state governors held charge as the incident commander for COVID-19. They've receded. Now, when they were in, the southern state governors, when they were in Lagos yesterday, what were they talking about? Did they mention anything concerning health?
No.
That means that for them, it's no more a priority. So we need to reprioritize. They need to come back to the public space and stand firm as incident commander and not let this thing recede from the public consciousness. All we hear now is that whatever is fighting, whatever is protesting. But interestingly, when the health challenge comes, it hits us so bad. So they shouldn't recede. They've receded. If they're going to recede, they need to put a figure, a public figure, respected public figure, to keep the conversation alive. They must not be tired. We cannot recede to the level of the tired repeats, you know, that is boring. This number of COVID at Abuja, this and that, and then everybody packs their load and go away. So now we keep talking, we keep signaling, we keep deepening the conversation, we keep engaging people at different times, we keep those protocols, because now I've not heard of anybody being prosecuted for not wearing face mask. Forget it, that will not happen. Nobody will prosecute anything.
You think so?
No, forget it. Nobody will prosecute anything for that. So now we have to live at the level of morality. Guys, you know, can you take decision to save yourself? That's where we are now. So we have to look for that kind of conversation that will appeal to those morality in such a way that people look at that, listen, I don't want to die, okay? And then follow through. So but if we are not doing that, what else do we do? Then possibly you resort to prayer and fasting. I don't know.
prayer and fasting, really?
I don't know.
But it's a lot, because let's tell ourselves the truth. People need to take responsibility for their safety as it stands with regards to this issue, seeing what is staring us in the face with the analysis that you have created so far. Now, and one aspect is that a lot of persons keep repeating in conversations like this is the aspect of the trust deficit. I don't know how far we have come with building that from your point of view, and if we can, you know, pull the strings right now as it is to build it while we are looking to, you know, re-engineer conversations around people owning their safety.
You know, I said earlier at the beginning of this conversation that there's a public fatigue.
Yes.
So many things are buffeting a typical African, a typical Nigerian in such a way that if you're talking about COVID, that they cannot really, that's not tangible to them, they look at it as, what are you talking about? It's a long route to rebuild trust. And rebuild the trust means that you are showing, you are walking the walk. People see you doing the thing essentially. But even if you look at the public appearances of the so-called leaders, face masks are essentially absent. The social distances are not there. You know, there are cues, there are what we call subliminal messages that you pass across when I look at you and I see you, okay? Once I pick that cue, I say, look, what's the big deal? You don't know that you are sending cues. So now, even the government needs to really go back to those levels. Now, the challenge of stimulating and helping them manage the economic depressions and the challenges that came with the COVID-19, government has kept quiet. They're not reaching out to anybody. People are still facing the challenge of school fees. The cost of food are skyrocketing. We are not seeing a way whereby, you see, for instance, Lagos saying that, listen, I know that the food is challenging. I have this stock of rice, I have this stock of beans for you to pick at this price, so that, you know, they're not seeing those kind of help. And when they don't see that help, what are you going to tell them that will make them trust you? And it will worsen the matter. They are in the public space where you see all sort of, you know, misgovernance, misapplication of funds, mismanagement. And they look at it that, listen, I am hungry, you're asking me to cover my nose. When you guys are having money, you are spending, you know, to your full. So these are it's a lot of complex issues. And that's why I say that, you see, everybody, the public is tired. They're tired. So now our challenge is to restore hope to the dying publics. To the dying public, you see a lot of depression, mental challenges, issues. The COVID reorder us in a different way. How do we restore hope to these people? How do we, you know, because again, first and foremost, to restore hope, we don't want a more deadly variant of called Delta variant to enter the country and further put the health system in a huge challenge. Of course, like I've said, the only way I know that can answer the question is that to look for vaccine anyhow, any means.
All right, your final word now as we, you know, wrap it up.
Guys, take charge of your health. I understand how you feel. I understand your issues. But honestly, look at yourself. Don't be in a hurry to leave this earth. Who knows? You might really want to change the whole thing. So stay alive, you know, take charge of your health and make sure that the little you can do to protect yourself from this virus, you do it. Don't depend on any rumors or any hearsay from anybody.
All right. Thank you so much, public health specialist, Dr. Tuyimi Bawandu, for your time on the program.
My pleasure always.